cabinet secretary has asked states to follow guidelines announced by the health ministry for people who have come into India from abroad who have an international travel history. He said that there's a huge gap in monitoring. There's no effective surveillance that needs to be done on an urgent basis to contain this pandemic. We're joined by Sunil Prabhu now for the latest on this. Sunil, this is something that NDTV has been reporting. People are not following the quarantine as seriously as they should. The guidelines. There's also news that we've covered about an IAS officer in Kerala who also did not follow these. What's the latest? I mean, some people would say that this guideline or this push from the centre has come a little too late.
I hope it's not too late. Definitely, as you're rightly pointing out, nearly 15 lakh people have come into India. India made the 18th of January some kind of surveillance, some kind of mechanism. The Ministry of Health and Family Welfare issuing guidelines to the states. Now, of course, that the centre is in control. The Chief Secretary, Cabinet Secretary has written to Chief Secretaries. He also through the video conferencing along with the Principal Secretary to the Prime Minister. They both are part of this crisis management group, effectively told them, the DGPs as well as the Chief Secretaries on the 22nd night, immediately after the Prime Minister's address, to look at this aspect. Now that there is a clear gap, as he points out, we hope the various district authorities as well as state authorities take effective measures to ensure that those 15 lakh international passengers, we must remember the coronavirus is an imported virus which has come from abroad. And if effective steps are taken, we will be able to contain it. And it's in this backdrop that the centre has asked state as well as district authorities to adhere to them, to have effective monitoring and surveillance of those passengers who have come in to India. And we hope they will be able to comply and follow these restrictions, because if there was effective management from the 18th of January, we wouldn't have been in this position. And if this lockdown has to work, then we need to have an effective surveillance of all those who have come after the 18th of January to ensure that they are monitored, they follow that quarantine of 14 days and adhere to those guidelines. In case they see any symptoms, they will be able to tell the health authorities, and they can be isolated and preventive measures can be taken for their early cure.